Today I'm talking to Dr. Chaand Nagpaul, who's chair of BMA Council and also former chair of the GP Committee. We'd like to talk about how COVID-19 has disproportionately affected our colleagues in the Black, Asian and minority ethnic group population.
We were not expecting these stark and disturbing statistics. It is really quite shocking when you consider that the first 10 doctors who tragically passed away from COVID-19 were all from a Black and Asian minority background. And what was even more upsetting is that so many of them, in fact, I think all but one, had come from other parts of the world to work in our National Health Service and had given their lives to saving the lives of others. And to be paying this ultimate sacrifice was a shock to all of us, because these sorts of statistics don't follow the sort of normal statistical variation you might expect, even allowing for about 40% of doctors coming from a BAME background. And now we have information about more than 20 deaths of doctors. About 94% have all come from a BME background. The picture is actually now wider than doctors, of course. We've had well over 100 healthcare workers who've also died of COVID-19, and the vast majority, about 70% plus, are again from an ethnic minority background.
Our colleagues have made an enormous contribution to the NHS, working in inner city Manchester, Birmingham and London, in places where it's not that easy.
I work in northwest London. In fact, in an area which has the highest prevalence of COVID-19. In fact, with the first hospital that had a critical incident, that's Northwick Park Hospital, is my local hospital. So I'm very well aware. And I want to just broaden this into the perspective of GPs, because for myself, it's also been shocking getting notifications virtually every day about patients that I know we've looked after for decades passing away, and getting notifications of their untimely death, because we're in an area with a high Indian Asian population, about 40%. So it has an impact both in terms of ourselves as doctors, because we of course are concerned about the impact of COVID-19 on healthcare workers and doctors and GPs, but also for our communities and the fact that they also are suffering. Clearly this infection is behaving in a way which on the one level we're told does not discriminate whether you are at top of society or not, but it does have a discriminatory or a differential impact on different ethnic minorities.
When we look back and see how our colleagues have been disproportionately affected by this virus, there may be lessons for the way forward.
I think that one of the important lessons here, and I really think it is important that we recognize truly from our hearts and as a nation how dependent our health service is, and not just about how much gratitude we should have for the contribution of our BAME doctors and healthcare workers more widely. General practice, owes its existence to what are termed the migrants of the NHS who came here. And in fact, many of surgeries now, which are large health centres with 20 doctors and ancillary staff, actually grew from an end of terrace house that first was occupied, and in fact, practices were created effectively from single-handed doctors who came from other parts of the world. And I think it's really important that we recognize the importance and the contribution and make that foremost in all of our plans for the NHS, that they are and we are an integral part of our health service, working alongside everyone else, and that without us, we wouldn't really have a healthcare service. But it also demonstrates that we need to be much more focused and targeted in being culturally sensitive, both for the healthcare workforce, but also for our population we look after. And I come back that as GPs, I don't see my existence purely about myself, but it's also about my sense of responsibility and a sense of duty for the population I serve. And I want fairness for doctors, and I want fairness for the community. And I think this whole episode of COVID has highlighted the need for both.
Today I've been talking to Dr. Chaand Nagpaul, Chair of BMA Council. With Chaand, I would like to thank our colleagues who have given so much to the NHS and express my condolences to the families who have lost loved ones. Thank you.